For Action News, I'm Anna Dolosky. It consumes about 20 hours per week per medical practice, and it costs medical practices tens of thousands of dollars. It's called prior authorization. It's an attempt from insurance companies to get doctors away from prescribing expensive treatments and gearing them toward less expensive alternatives. Today's op-ed in the New York Times paints this picture perfectly, as one doctor shares the frustrating experience in dealing with prior authorization while risking the declining health of a patient. And while on paper it's a reasonable way to reduce medical costs, it could ultimately end up costing the healthcare system. Those denied medications had higher overall medical costs, and not getting the right medications worsen their conditions. Action's Dr. Gilbert Ross speaks from experience when he says prior authorization is penny wise and pound foolish.
There's an op-ed in today's New York Times written by Dr. Danielle Offrey, who's a faculty member at the NYU School of Medicine, and it really tells the one anecdote from a very, very long bunch of travails that beset the primary care physician at every level: pediatricians, internists, general practitioners, especially those who use medications a lot as opposed to surgeons. When you're trying to balance a complicated patient's pharmaceutical regimen, a patient, an older patient especially, or even a younger patient with multiple comorbidities, multiple diagnoses, the balancing act that's often required with different medications is very demanding on both the patient and the doctor. And prior authorizations are those forms that physicians need to fill out to get a pharmaceutical, an insurance company to approve a pharmaceutical a drug that's a brand name usually and way more expensive than the generics that are being encouraged to be used more and more because they're much cheaper. And their generic drugs are usually pretty much as effective as the brand name expensive drugs, but sometimes they're not. The Dr. Offrey op-ed points out that 20 hours is an average number of hours spent in a doctor's practice in a week to get prior authorizations, to figure out how to get to the most effective person to approve such medications. Dr. Offrey's op-ed points out that a study done on 4,000 diabetic patients who had their prior approval, prior authorization for drugs denied, showed that healthcare costs, including insurance payment costs, were increased in those thousands of patients because obviously health outcomes declined, and thus that costs more money in healthcare later on. So it's being penny wise and pound foolish, as we often see. And this is an issue that many people, maybe a majority of people, are going to run into if they haven't already, getting drugs approved by the insurance company that are not on the approved list. They're extra special 3-star or 4-star drugs instead of 1-star drugs that require an extra $50 or $100 a month that many people cannot afford. And to get a doctor to write a letter or to call an insurance company in this day and age when doctors are already being overwhelmed with too many patients, it's really a tough obstacle, and it's going to compromise medical care quite often. And this is something that is not taken into account with many the new coverage laws, including Obamacare or the Affordable Care Act. I don't think they deal specifically with the extra time that's being devoted to doctors' offices and doctors themselves having to deal with insurance company denials. It's easy, for them to put such a thing into a law and say, well, we're going to save a bunch of money in healthcare dollar spending because we're going to keep patients on cheaper drugs. But then you run into the real world where patients are actually getting sicker if they're not allowed to have the drugs that they need.
To read this story and others, you can head to our website, action.org. And while you're there, don't forget to also sign up for your daily dose of news delivered right to your inbox. For Action News, I'm Anna Dolosky.